Or budget.
Okay, is
Wherever you are.
right on my desk. Good afternoon, everybody. Welcome to the Budget and Taxation Subcommittee on Health and Human Services. We're going to have members coming in and out. It's starting to get busy time of session, but just to respect the administration and other folks that are going to be presenting, Ms. Zimmerman, we want to kick off. So with that, we're going to present the analysis, and then we'll hear from the administration. So with that, Ms. Zimmerman.
Thank you. I'm going to begin on page 1 of the analysis of the Family Investment Administration. The fiscal 2025 budget increases by $69.3 million. This is overstated by $10 million because $10 million that was for the food banks that was in the dedicated purpose account in fiscal 2024 has been moved to the department to administer by budget amendment. It's not reflected in the working appropriation, and the fiscal 25 allowance budgets it directly in the department's budget. If you turn to page 7, this begins the discussion of the performance measures. In general, applications for benefits are to be processed within 30 days, though expedited SNAP applications are required to be processed within 7 days. If you turn to Exhibit 1 on page 8, you can see how this extra time requirement translates into lower average benefit processing times, application processing times for SNAP than TCA and TDAP. In general, the application processing times have increased since the restart of recertifications in January 2022, but they have been a little lower in January 2023 than they were in the prior year. Or in calendar 2023 than the prior year. However, for TCA and TDAP, they remain higher by about 2 and 4 days compared to the restart of recertification. In general, TCA application processing times exceed SNAP by between 8 and 15 days, while TDAP exceeds SNAP by 11 to 16 days. Exhibit 2 on page 9 presents information on the share of applications processed within 30 days. As you can see, although the TCA and TDAP have similar average days to process applications, they have very different shares of applications processed within 30 days. TDAP has a lower share with only one of 10 quarters having more than 70% processed within 30 days, while TCA, that's been true in 8 of 10 quarters. If you turn to Exhibit 3, this shows the percent of applications processed in 46 days or longer, and this tells a similar story with TDAP having 25% on of applications processed in longer than 46 days in all but 1 quarter, while TCA and SNAP did not experience this in any quarter. We've asked the department to comment on the efforts it's taking to improve application processing timeliness for TCA and TDAP. Exhibit 4 on page 11 presents information on the application denial rates. In each month since August 2022, the application denial rates for TDAP have exceeded 75% and have exceeded 80% in each month since May 2023, and actually reached 93% in August 2023. TCA has experienced similar increases with over 70% in all but 3 months during that time and exceeding 75% in 3 of the last 6 months. SNAP application denial rates are considerably lower and are generally under 30% during the entire period. Exhibit 6 on page 13 shows the missed interviews as a cause of all application denials. So you may recall that at the beginning, that during the pandemic, kind of through December 2021, interview requirements were waived for all programs, and then for expedited SNAP cases through June 30, 2023. With the end of the waivers, missed interviews became a top reason for application denial for all programs, so it is more common among SNAP applications. In 12 of the 20 months between January 2022 and September 2023, missed interviews accounted for 20% more than 20% of denials. However, in October of 2023, the department received a waiver of these interview requirements for SNAP and applied that also to TCA and TDAP. That's in place through May 2024, and you can see that had an immediate impact on the application denials for this reason. Moving ahead to a discussion of the case closures, Exhibit 8 on page 16 presents information on the share of case closures that are due to failure to recertify. This is shown by program for each quarter since the restart of recertification. As you can see in the bars on the far left-hand side, which are related to SNAP, this is the predominant cause of case closures for SNAP, with over 80% of closures due to this reason in 5 of the 7 quarters. It is also a common cause of case closure for TCA, though at a lower rate. However, it has been less than 40% in the last 3 quarters. And while a much lower cause of case closure for TDAP, this has been trending up in each quarter and was nearing 20% in the most recent complete data. Exhibit 9 presents the share of case closures due to failure to provide verifications. This is a primary cause of case closure among TCA, a lesser extent for the other programs. In 4 quarters, they've had more than 40% of case closures due to this reason, and over 50% in 1 quarter. We've asked the department to comment on efforts it's taking to reducing case closures due to failure to provide verifications. If you turn ahead to the 4th performance discussion, which begins on page 19, this is a discussion of the Public Assistance to Adults program. This program provides a monthly benefit to assist individuals in certain types of living situations, like assisted living, rehabilitative residences, and similar, like an adult foster care type situation. Individuals must have a verified need for a protective living arrangement and must be applying for SSI or SSDI. To be financially eligible, they must not have assets exceeding $2,000. DHS generally offered the same flexibilities for recipients of this program that it did for the SNAP, TCA, and TDAP program. And so recertifications began for this program in January 2022 as well. Exhibit 11 on page 20 shows kind of the history of the average monthly recipients in this program. You can see prior to the pandemic, the caseload was declining, but at a pretty slow rate of less than 1.5% per year. Beginning in fiscal 2020, and then in fiscal 21 and 22, the caseload declined by more than 7% each year. And with the restart of recertification, in January 22, the caseload declined by 25%. It has been a slower rate of decline in fiscal 24 of just over 3%, but still declining. This is of some concern as the caseload had been relatively stable prior to the pandemic. So DLS looked at the causes of case closure in this program, which are shown on page 21 in Exhibit 12. The 2 leading causes are failure to recertify and no eligible members. No eligible members are kind of like non-financial factors, non-financial requirements. So failure to recertify was the more than half of the case closures due to this reason, and all but 5 of the months during the period examined, peaking at 85% in May 2022. But this has come down a little bit in recent months. Given the relative stability of the caseload in the years leading up to the COVID pandemic and the more limited impacts of the economy on recipients of this program, it's unclear why the caseload declined so rapidly and with so little rebound after the initial closures. And we've asked the department to comment on that, to outreach effort to these recipients and potentially eligible individuals to ensure they're aware of the program and the requirements to recertify. Page 22 begins the kind of budget discussion that starts with fiscal 2023. Supplemental budget number 5 of the fiscal 23 budget included $35 million within the dedicated purpose account to be used only for an additional $45 per recipient per month benefit for TCA and TDAP recipients above their regularly calculated benefit. The funding was transferred by budget amendment to the administration, and the department used those benefits, began issuing those benefits in that year. DLS estimates that a total of $33.5 million was needed to pay for that additional benefit, which is less than $35 million that was allocated. The language that directed the funds to be used for that purpose requires that the funds reverted if they were not needed for that purpose or not used for that purpose. However, the department reported during the fiscal 23 closeout that it had used all $35 million, and the budget books also indicate they had used all $35 million, although they did not appear to have spending to justify the full use. And we've asked the department to comment on why the funds did not revert back to the dedicated purpose account as required. On the bottom of page 22, this begins the discussion of the funding that was added to the family investment budget in section 19 of the fiscal 2024 budget bill. A total of $6.49 million in general funds was added. The largest share of this was for $5 million in the Maryland Office of Refugees and Asylees for assistance to immigrants relocated from other areas. As of January 26th, the department reported that it had plans for spending $4.7 million for 4 grants, which are described in more detail on page 23. The remaining $300,000 will be allocated at a later date. If you turn to page 24, Exhibit 13, this provides information on the remaining $1.49 million, which was provided for the Office of Grants Management for a variety of grantees. The department has executed 7 grant agreements for these grantees. 2 were still in process as of January 26th. One of the entities no longer exists, and so those funds will revert back to the general fund. Funding for 2 of the grantees, the Maryland Food Bank and the Capital Area Food Bank, continue in fiscal 2025. The remainder do not continue. There are 6 deficiency appropriations for family investment totaling $20.4 million. 2 of those adjust the funding for the temporary cash assistance and TDAP program based on anticipated caseloads, resulting in a net increase of $2 million in general funds in the assistance payments program. The largest deficiency appropriation totals $8.7 million, and it's related to a new call center contract. Although budgeted only in FIA, the increased funding is for a department-wide call center contract that was approved by the Board of Public Works on January 31st. The fiscal 2025 allowance provides an additional $12.3 million for the new contract. There's additional deficiency appropriations, including $6.9 million for employment and income verification contracts and $1.8 million for an asset verification system contract, as well as $1.1 million for a relocation. The beginning of the discussion of the fiscal 2025 budget begins on page 25. The total allowance is $2.78 billion. 86% of that is for assistance payments. Exhibit 14 on page 26 shows the areas of spending within the assistance payments program. The majority of that is for SNAP, which is over $2 billion and accounts for 74% of the total FIA budget. The TCA spending totals about 5.6% of the Family Investment Administration allowance. If you turn to page 28, Exhibit 15, this shows the areas of spending for kind of the rest of the FIA budget, which totals about $394 million. About half of this is for personnel expenditures. Exhibit 16, which begins on page 29 and continues for several pages, details the areas of change in the budget. I'm just going to highlight one of these, which is the first item. This is another item that although budgeted in FIA, the department indicates is a department-wide amount of funding of $19 million, related to a variety of personnel costs, including filling vacant positions at higher salaries, supporting contractual conversions, and aligning some expenses with recent experience. If you turn to page 32, this begins the kind of review of the adequacy of the general funds in the assistance payments program. It begins with a discussion of the number of recipients in the temporary cash assistance, TDAP, and supplemental senior benefits for SNAP. In general, with the restart of recertification, the TDAP and TCA caseloads declined substantially after January 2022. It declined by about 34% for TDAP and about 16% for TCA by June. After that, there was some rebound in the caseload initially for TCA, although it declined again between August 22 and June 23 by 12.5%. It subsequently rebounded in the first half of the fiscal year, but fell below 50,000 in December 2023. The TDAP caseload kind of steadily rose after this decrease and was about 11,000 in December 2023, which was closer to the level at the prior to the restart of recertification and much closer to the pre-pandemic levels for the program. The supplemental benefits for seniors program was effectively suspended during the pandemic. Emergency allotments that were provided under the federal SNAP program meant that no individuals fell below the $40 benefit level that would have qualified them for this program. With those allotments ending in February 2023, the benefits under this program began to be issued again. In the first month of issuance, there was about 33,000 recipients, which was about 31% higher than March 2020, which was the last prior month of issuances. However, the number kind of steadily declined after that time and was about 27,600 in December 2023. Page 33, Exhibit 18, summarizes kind of the adequacy of the funding. Overall, DLS projects surpluses in both years, which are driven by the temporary cash assistance program due to lower anticipated caseloads. The SNAP supplemental benefit for seniors, which is primarily driven by the benefit level that was assumed in the budget, which is a higher level of benefit that could be provided under the current statute, and other public assistance, which is driven primarily by the decline in the public assistance to adults caseload that I discussed earlier. This is largely offset, but not entirely offset, by the TDAP program, where the budget funds the program at near the level of the fiscal 2023 actuals of recipients. However, the caseload, as I noted, has continued to rise since that time. Page 34, there is a section there on the SNAP program. The fiscal 25 allowance includes, as I noted, $2 billion for this program, which is a decrease compared to 24. However, DLS estimates only about 1.48 billion is needed for the program. The difference with the allowance is primarily due to the benefit levels. The benefit level that the budget could support is about $490 per month, whereas the actual average benefits in recent months are $333. DLS recommends reducing the federal funds by $200 million to better align with spending while still leaving a surplus. Page 35 contains some personnel information. The department's vacancy rate has, the Family Investment Administration's vacancy rate has declined substantially since December 31, 2022. It has decreased from 15.3% to 7.1%. Despite the substantial reduction in the vacancy rate, the budgeted turnover increases from 7.69 to 8.64%, and that would be about 30 positions, require about 30 more positions to be vacant than are currently vacant. And we've asked the department how it will fully fund salaries and wages given the higher relative budgeted turnover. The discussion of the issues begins on page 37. Chapters 635 and 636 of 2019 created the Summer SNAP for Children program, which provides a supplemental benefit of $30 per month in the summer months and $10 in December for school-age children receiving the benefit. The program requires a local match determined by the local cost share, and jurisdictions must apply to participate in the program. Given the limited funding, not all eligible children are able to be served in the program, even in jurisdictions choosing to participate. The acts mandated $200,000 for the program. However, in fiscal 2023 and 2024, $5 million was provided for the program. Exhibit 20 on page 38 shows how that's translated to the recipients. You can see in the first couple of years of the program, with the lower funding levels, only a few jurisdictions participated and fewer than 5,000 children received benefits. In the subsequent 2 years with a higher level of funding, 14 jurisdictions participated with substantially more children being served. In fiscal 23, in the fiscal 2023, there were 4 jurisdictions that provided sufficient local contributions beyond what was required of them to allow for all benefit or all eligible children to receive a benefit. In fiscal 24, it was 3 jurisdictions that did so. And that is shown in Exhibit 21 on page 39. The number of children served in those 3 jurisdictions, Anne Arundel, Baltimore County, and Queen Anne's County, is a little bit less than 100% due to benefits that were unable to be issued after the children were initially identified. But they did provide sufficient funding to provide those benefits. Overall, with a higher level of funding, about 56% of children eligible in those eligible children in those jurisdictions received benefits. Page 41, Exhibit 22, shows the funding for the program in fiscal 2024. The state funds, as I noted, totaled $5 million. The required local contribution was $2.7 million. However, the local governments that participated actually provided $4.5 million. This higher level was driven primarily by those 3 jurisdictions that provided funding sufficient to serve all children in those jurisdictions. The Federal Consolidated Appropriations Act authorized a new optional nationwide permanent summer EBT program that will begin this summer. The benefit is $40 per month per eligible child for a 3-month period, and that will increase with inflation in subsequent years. When states elect to participate, they're required to automatically enroll those eligible for free and reduced price meals in the year preceding without additional application, but also make an application available to others who were not eligible at that time. For this program, states must make an individual determination of eligibility, which can be determined through the school meals program application, or the one difference with the pandemic EBT program that was provided during the pandemic is that in community eligibility provision schools in the PEBT program, all children received the benefit or were able to receive the benefit. But in this program, there is an individual determination of eligibility. To be eligible, children must be attending a school that participates in the school meals program. However, if children are receiving SNAP, the state's TANF assistance, or certain other means tested benefit, they can participate in the program even if the school they attend does not participate in the school meals program. Households have from the year prior, the start of the school year prior through the end of the summer operational period to apply to receive the benefit, and they would receive the full summer benefit no matter when they were determined to be eligible. A couple other differences with SNAP and the pandemic EBT program is that states have to provide the benefit during the period. During the PEBT program, the benefits often were provided much later due to the timing of approval of the state plan. The other difference is that the benefits are only available for 4 months, whereas the traditional SNAP benefit is generally available for 12 months after distribution. States had until January 1, 2024 to submit a notice of intent of their intent to participate in the program this summer. And Maryland was among the first states that the USDA announced had done so. States have to submit an interim plan of operations and a final plan of operations. The interim plan was due December 15th or as soon as practicable. The department indicated they were not able to submit that plan at that time because they needed to confirm they had funding to support the administration of the program. And we've asked the department to comment on the status of the plan and any initial allocation and other efforts to implement the program. Exhibit 23 on page 44 presents a comparison of the Summer SNAP for Children state program and the federal summer EBT program. As you can see in this exhibit, the benefits are higher in the summer months, though there is no December benefit. In the summer EBT program, it's available to more children beyond those who are SNAP eligible, and it's available in all jurisdictions, as opposed to the summer SNAP, which is available in only those that participate, and given the limited funding, not available to all children within those. The other key difference is the funding to support it. In the summer EBT program, the benefits are 100% federally funded, with the state and federal government sharing in the administrative costs, whereas the entirety of the summer SNAP program is funded with state and local matching funds. The department has introduced legislation to make some minor modifications to the administration of the summer SNAP program. These are primarily administrative type changes, but it also increases the mandated funding level to $5 million. As introduced, it does not modify the program to limit the duplication with the federal summer EBT program, and as I mentioned, increases the required state funding. DHS indicates that it's submitted language that would amend the bills to allow the appropriations to have more flexibility. Although DLS had not seen the language, it's unclear how it would modify the bills to provide the flexibility, how that would work in practice given the other requirements of the program for local matches and specific benefit levels, or why alternatively the mandate would not simply be removed, as language is not required to have funding to administer the federal summer EBT program. The fiscal 25 allowance includes $9 million in general funds under the summer SNAP program, along with $1.6 million that's a placeholder for the local matches. However, DHS has indicated that the $9 million is actually meant to serve as the state share of the administrative costs for the summer EBT program. And as such, the mandate has not been met for the program. And the rest of the funding is the federal funds, which is the $9 million federal match, and the $60 million anticipated in benefits. The fiscal 25 funding for the administrative costs is budgeted in the assistance payments program, which is designated solely for the payment of benefits and is not used for administrative costs. And so DLS recommends adding language to transfer the funds to an administrative program. In addition, DLS recommends deleting the special funds, which will not be needed since there is not a funding for the state share of the summer SNAP program. Issue 2 begins on page 45, related to the replacement of benefits due to EBT theft. The Federal Consolidated Appropriations Act requires reimbursement for SNAP benefits lost due to skimming from October 1, 2022 through September 30, 2024. During that period, the benefit replacement is paid for the SNAP cases with federal SNAP funds. This is not otherwise an eligible use of the funds. However, there are limitations on the amount of benefits that can be replaced under this law. In addition, it does not cover cash assistance programs, and chapters 171 and 172 of 2023 were emergency legislation that required DHS to restore lost benefits to a household due to EBT theft. The benefits are required to be automatically restored without additional action by the household if the department, its investigation shows that the benefits were lost due to EBT theft. In general, they have to be restored within a certain period of time. DHS is prohibited from placing a limit on the number of months in which a benefit households can receive the replacement benefits. And it also covers periods not covered by the federal legislation, particularly the period from January 1, 2021 through October 1st, 2022. Maryland was the first state to receive federal approval of its state plan for the replacement of SNAP benefits, and that began implementation on March 18th, 2023. Exhibit 24 on page 47 provides information on the replacement of benefits by month for the cash and SNAP benefits. In total, in fiscal 23, about $7.4 million was replaced, about $5 million of that for SNAP. In fiscal 24 through December, about $9.5 million has been replaced, with $7.6 million of that in SNAP. This is expected to exceed the appropriation for this level, but there is surplus of general funds, as I noted earlier, for the cash program that will cover the cash assistance shortfall, and additional federal funds will be drawn down to cover the SNAP benefits. In fiscal 2025, the budget provides a total of $27.9 million for this purpose. $26.3 million of this is general funds. The high share of general funds compared to the prior years is due to the end of the ability to use federal funds for this purpose after September 30th. DLS estimates, however, only $15.2 million in total is needed for both the SNAP and cash benefits based on the spending trends in the program, and therefore recommends reducing the funding provided by $7.5 million, which still leaves a surplus in the event that replacement benefits are higher than expected. The department has undertaken other activities to reduce the impact of skimming. On page 48 and 49, it outlines some requirements that were included in an RFP for a new EBT system that was released in September 2023. In addition, with the current vendor on page 49, there's some discussion of actions they've taken, which include allowing recipients to lock and unlock their EBT card through an app and also have access to activity alerts. We've asked the department to comment on additional steps they're taking to reduce incidents of EBT theft. Issue 3 relates to the able-bodied adults without dependents in the SNAP program. These recipients are subject to work requirements. They cannot receive benefits for more than 3 months in a 36-month period unless they're participating in an employment and training program or working for an average of 20 or more hours per week. These requirements were suspended during the national public health emergency until 1 month after its end. So they were suspended through June 30, 2023. The state has a partial waiver in 5 jurisdictions through June 30, 2024. However, recipients in non-waive jurisdictions began reaching their 3-month limit in October 23. In addition, the Fiscal Responsibility Act passed by Congress made some changes to the requirements for the program. These are outlined on page 50. It increased the age of recipients who are subject to the time limit from 49 up to 54. That's phased in over time, and it's only through October 1, 2030. However, it did provide additional exceptions to the requirements for individuals who are homeless, veterans, or individuals who are up to age 24 who are formerly in foster care and aged out of foster care. The state also receives discretionary exemptions that can be used to prevent terminations of benefits for individuals in non-waive jurisdictions. The percent of those exemptions received was also reduced in the Fiscal Responsibility Act. In addition, states could historically carry over all unused exemptions, but beginning in federal fiscal 2026, states will only be able to carry them over from the prior year. Page 51 describes some of the net impacts of the changes. Overall, DHS indicates that as of November, about 6,100 SNAP recipients were newly subject to the requirements with the increase in upper age limits. The department was using its discretionary exemptions to prevent termination of benefits due to this reason, but they expected to run out of these discretionary exemptions at the end of February 2024. Exhibit 25 on page 52 shows the number of ABOD individuals by jurisdiction as of November 2023. And we've asked the department to comment on the outreach efforts to those potentially impacted by the requirements and to explain that the requirements have changed. The next issue and final issue that I'll be covering relates to changes to the work requirements and reporting of work. that also were included in the Fiscal Responsibility Act. As part of the work participation standard, states can have the work participation rate reduced by reductions in their caseload since that time, compared to a base year. The base year previously was federal fiscal 2005. The Fiscal Responsibility Act changes it to federal fiscal 2015, a year that the state had 4.5% fewer recipients than in the previous base year. It also eliminated the ability of states to count certain families towards this work requirement, but added reporting requirements that focus on outcomes for work programs and authorized a pilot project for up to 5 states to use negotiated benchmarks for work and family outcomes in lieu of the work participation rate. In November 2023, the U.S. Department of Health and Human Services issued a request for information regarding the provisions related to the reporting on work outcomes in the authorized pilot project. And we've asked the department to discuss whether it expects to apply to participate and its readiness to implement the new measures. If you turn ahead to page 57, this begins the recommended actions. The first recommended action is language that restricts the funding for assistance payments program to be used only for that purpose. This is different than language that was adopted last year because it provides 2 exceptions to that. The first is to allow for transfers of general funds to the foster care maintenance payments program or child welfare services program for the purpose of replacing the TANF funding. This was the recommendation that was mentioned in the DHS overview. The second is to allow the transfer of the funding for the summer EBT administration to be transferred to a program for administration. And that recommendation is shown on page in recommendations 2 and 5, transferring that funding to an administrative program rather than the entitlement program. Recommendations 3, 4, and 6 were already discussed in the analysis. Recommendation 7 is a committee narrative that would request a report on application processing times, denial rates, and case closures. And recommendation 8 on page 60 is a committee narrative that would ask for information on the implementation of the summer EBT program, the administrative costs, and the participation in the program. That concludes my presentation, but I'm happy to take any questions.
Seeing no questions, Ms. Zimmerman, at this time, we'll call up the agency.
Good afternoon, everyone. Chairman McCray and members of the subcommittee, my name is Rafael Lopez, and I serve as the Secretary of the Department of Human Services. We'd like to thank Governor Moore, Lieutenant Governor Miller, our colleagues at the Department of Budget Management, and the budget committees for their support. We are grateful to the Department of Legislative Services Analyst Tanya Zimmerman for her budget analysis. Joining me at the table today is, to my right, Principal Deputy Secretary Carnita White, and to my left, Acting Chief Financial Officer Carol Resnick. We have senior members of our leadership team present with us today, including the Director of the Allegheny County Department of Social Services, Courtney Thomas Winterberg, Assistant Secretary for Policy Heather Zanoni, Chief of Staff Webster Yee, and Acting Executive Director of the Family Investment Administration, Augustin Intabagana Yamana. At DHS, we empower every Marylander to reach their full potential by providing preventative and supportive services, economic assistance, and meaningful connections to workforce development and career opportunities. We are committed to unlocking opportunities for the over 1 million Marylanders we serve. The Family Investment Administration is the largest service program within DHS, accounting for 67% of the department's $4.1 billion budget and serving an average of 943,000 Marylanders annually. This team together administers federal economic assistance programs that ensure seniors don't have to choose between buying medicine they need and paying for their rent, helps families put food on the table, helps keep children in their homes, and fosters connections to work and career development so Maryland does not continue to leave potential on the table. Today, I'd like to draw your attention to 10 key pieces of our budget and work to frame up our early contributions to deliver on Governor Moore's goal of ending childhood poverty in Maryland. The first item we'd like to highlight is the issue of stolen benefits. Prior to this administration, the pleas of Marylanders whose food and cash benefits were stolen by thieves went unanswered. Governor Moore's charge is clear. We want to do right by Marylanders. Since March 2023, DHS has replaced over $20 million in stolen benefits to over 31,000 Maryland households. Maryland became the first state in the nation to reimburse stolen benefits and combat nationwide organized theft. While being first was certainly not the assignment, we moved with urgency to respond to Marylanders in real time. We added new security features for our customers so they can lock and unlock their EBT cards when not in use and receive SMS text messages and emails to monitor card transactions. We launched our work in partnership with customers themselves, community-based organizations, advocates, and even those that have sued us. We did so in the spirit of partnership and transparency, and in English and in Spanish to better serve our customers. No protection for dispersed federal entitlements existed before January 2023. The governor's budget includes a total of $27.8 million to continue efforts begun in 2023 for replacing stolen Supplemental Nutrition Assistance Program, or SNAP, and temporary cash assistance, or TCA, benefits. Of note, the proposal represents $26.2 million in state general funds and approximately $1.6 million in federal funds. As you know, Maryland budgets 1 year at a time, and this funding will enable DHS to reimburse stolen benefits to Marylanders through June 30th of 2025. As we move into year 2 of our work, we are enhancing the Stolen Benefits Replacement Program to provide more relief to families affected by benefit theft. You'll be hearing more about our approach via HB 1434, which is scheduled for hearing on March 5th. We will continue moving with all deliberate speed to use chipped cards in Maryland to secure people's benefits. And we are partnering with federal agencies to decrease the amount and frequency of thefts that we are seeing nationwide. We cannot do this work without partnerships at every level. I'd be remiss if I didn't add that's come to our attention that some folks are sharing with the General Assembly members that DHS does not want to reimburse benefits. And I'd like to just shut that down quickly on the record. That's simply not true, not based in fact. The second item we'd like to bring up is the issue of summer EBT. The summer EBT program is critical to our strategy to spend more strategically in our work to end childhood poverty. With summer EBT, we will leverage federal funding to expand benefits currently provided under the Maryland Summer SNAP Act to serve all eligible children across the state. Building on this legislature's investment in summer SNAP, we will draw $69 million in federal funds per year to do it, no longer leaving federal dollars on the table for which Marylanders are eligible. We will help families feed their children in every single jurisdiction across Maryland, which is not the case right now. When the state summer SNAP program launched in 2019, we served 3,923 children in 4 jurisdictions. During the summer of 2023, we served 90,571 children in 14 jurisdictions. Lack of local funding and bureaucratic barriers kept many counties from opting in to Maryland's summer SNAP. By innovatively and seamlessly combining the federal summer EBT program with Maryland's existing summer SNAP program, we will help feed 500,000 children across Maryland in every single one of its 24 jurisdictions. We will provide benefits to all children eligible for free and price-reduced school meals, including those not currently enrolled in SNAP. The third item I'd like to mention is our work to enhance outreach with our community partners. We partner with 31 community-based organizations that conduct outreach to help enroll families in SNAP and cash assistance programs throughout the state. These organizations play a vital role by providing application support to ensure that households renew their benefits. This partnership helped make sure that 21,766 households submitted an application or renewed their benefits last year. We are especially grateful to Maryland Hunger Solutions, Lifestyle of Maryland, Benefits Data Trust, and others who helped us roll out the Stolen Benefits Replacement Program. They helped answer calls from families that were defrauded and helped them submit claims for benefit replacement. They responded to our call to test our online application to make sure that it was simple and seamless. We could not have done this work without their partnership, and we are grateful. We are pleased to report that the U.S. Department of Agriculture approved our request of nearly $6 million to support outreach efforts provided by our partners, and we look forward to exploring new ways to improve, learn, and grow together with our partners as we serve Marylanders. The fourth item I'd like to lift up is our work to create partnerships, and that's all about investing in the creation of career paths for more customers. As we continue to unwind from the pandemic, we are committed to working with our partners at the state and local level to, number one, increase access to career training programs, number two, streamline workforce development, and three, remove barriers to employment such as childcare and transportation. Our anti-poverty efforts can never be fully achieved without clear strategies to provide education, training, and support to our customers on their journey to thriving economically. In federal fiscal year 2023, only 4,508 temporary cash assistant or TCA and 3,897 SNAP customers participate in employment and training programs. However, there are more than 70,000 Marylanders who are ready, willing, and able to participate in workforce development programs. To enhance participation and ensure all eligible customers continue to receive food and cash assistance benefits without interruption, our goal is to improve the quality of our programs by increasing options for our customers. We will work to establish SNAP employment and training, or ENT programs, in communities that have been underestimated, undervalued, and underserved, particularly in Eastern and Western Maryland. We will partner with the Department of Labor to improve access to apprenticeship and other programs that the department funds. And we will coordinate with Workforce Innovation and Opportunity Act partners to connect customers who are working but want to advance their careers. The fifth area we'd like to highlight is the work to enhance SNAP payment accuracy. As we work to build trust and reestablish strong working relationships across the state, we will move with integrity and transparency. On June 30th, 2023, the United States Department of Agriculture announced federal fiscal year 2022 SNAP payment error rates for the first time in 3 years, given the COVID-19 public health emergency. Unfortunately, Maryland now has the dubious distinction of having the second worst error rate in the nation. Since receiving the news of the state's error rate, we have moved urgently and remain outcomes focused on getting this right, because the consequences for not turning this around will only hurt the very Marylanders in whose names we serve. We are working proactively with our USDA partners and communicate with them regularly on our action steps. I want to be crystal clear that the SNAP payment error rate is not a fraud error rate. This isn't about our customers doing something wrong or incorrectly. It's about us and our department. Payment errors are largely unintentional, and in each case that was reviewed, all errors have been corrected. We also learned that high staff turnover rates during the pandemic, especially at a time when new applications for SNAP benefits were soaring, created administrative burdens and delays for the local departments of social services who lead this work on the ground. We must continue to do more to invest in our people, teams, and training to make sure everyone is up to speed on policy and is supported to do this work well. We're pleased to share that since January 2023, we hired nearly 200 new family investment caseworkers and supervisors, reducing our program vacancy rate by half. We are working closely with our USD partners to develop and implement corrective action plans to mitigate our errors and ensure timely and accurate SNAP payments moving forward, including additional training. In fact, we have a quarterly leadership call with USDA to make sure we're on time and on task to get this right. We will lead by taking accountability for continuous quality improvement. We also corrected more than a dozen critical E&E system defects that significantly contributed to SNAP payment issues last year, or over the past couple of years. E&E, which stands for Enrollment and Eligibility, is the main application we use on the MDThink platform to manage SNAP and many other benefits. None of this happened overnight, and yet we're taking proactive steps in the right direction to problem solve. The sixth area we'd like to highlight is the issue of our work around Office of Home Energy programs and how we're trying to enhance customer service statewide. Each year, the Office of Home Energy programs, or OHEP, provides services to 100,000 Maryland households, many of whom are seniors, so they can pay for utilities needed to stay warm during the winter months, prepare meals throughout the year, and power essential equipment such as oxygen tanks and other medical equipment. Unfortunately, for far too long, we have failed to address systemic customer service issues in this life-saving program. Our local administering agencies, or LAAs as they are known, are simply not processing OHEP applications fast enough to prevent utility shutoffs. In some cases, it takes months before a customer receives a decision on an OHEP application, and this is simply unacceptable. We are taking a multi-pronged approach to improve access to energy programs. We are simplifying the online application, and we are setting clear expectations with our LAA partners for case processing timeliness and customer service. And we recently implemented a new standard operating procedure to better identify and prioritize emergency applications for households at risk of experiencing utility shutoff. But I've already visited every jurisdiction across the state multiple times to better understand where and how we can improve overall. I'm personally committed to visiting all OHEP offices in the next few months to learn firsthand the challenges that they face and how we improve the experiences of our customers. I hear directly from community organizations and customers every day. We must and we will do better this year, and we look forward to reporting on our results to you next year. The seventh area is about supporting immigrant communities and how we're doing this in partnership with many organizations across the state. Our department is home to the Maryland Office of Refugees and Asylees, or MORA, where we partner with the federal government and local community organizations to better support immigrant communities. Our budget proposal includes additional funding to enhance immigrant integration efforts. Immigrants come from all over the world. They are our brothers and sisters, and they contribute to the vibrancy of our communities in every possible way. They are valuable assets to our state and our nation as they contribute to our economy, they pay taxes, and they add extraordinary diversity to our communities. The $5 million of the legislature provided to our department in the FY24 budget paid for essential services including housing, transportation, healthcare, case management, employment and trading, and legal assistance. We strategically invested in 4 projects. The first was around emergency response. We partnered with community organizations to address the urgent and immediate needs of migrants and asylum seekers, such as temporary shelter, food and basic needs, emergency healthcare, transportation assistance, educational support, and most importantly, holistic case management support. The second area we invested in was respite care. We worked to make sure and provide short-term relief and a respectful welcome for incoming migrants, providing a safe place to stay and support to continue their journeys. The third area we invested in was comprehensive healthcare. We worked to leverage an existing community-based healthcare infrastructure to make sure immigrants who are ineligible for traditional Medicaid and have no medical insurance had access to care. The fourth area we invested in was long-term resettlement support. For asylum seekers who have chosen to resettle long-term and call Maryland home, we worked on a pilot project to support families through a range of services that facilitate integration into local communities. We'd like to take this moment to publicly acknowledge and thank a few key partners that brought this work to life. Within the Montgomery County government, County Executive Mark Elrich, Chief Administrative Officer Rich Madalino, and members of his team, Bibi Otero and Sonia Mora, have been instrumental in modeling how we strengthen state and local partnerships to respond more seamlessly. The leadership of community organizations like Healthcare for the Homeless, Seventh-day Adventist Church, Identity Inc., and SAMU First Response have been allies in our collective and humane response and service to the people of Maryland. And finally, to Secretary Strickland and his team of the Department of Emergency Management, we are grateful for their leadership as our partners every step of the way. The eighth area we'd like to highlight is building on this work, what we do more traditionally around building capacity in communities to support immigrants and asylees through MORA. The state of Maryland partners with the federal government to resettle individuals admitted to the United States as refugees or have been granted humanitarian immigration status. The people we have the honor of serving have been uprooted from their homes because of religious, racial, or political persecution and are unable to return. During federal fiscal year 2023, we served 2,890 refugees, special immigrant visa holders, and other eligible populations within their first 12 months from their date of arrival. Overall, we helped 5,580 individuals. Using exclusively federal funds, we provided cash assistance, case management, job placement services, youth mentoring, school integration services, medical assistance, and much more. The ninth area we'd like to highlight is our work to course correct and strengthen MD Think. We have not been shy in speaking truth about MD Think, which has had significant issues with fiscal management, strategic focus, and operations. We inherited a system hindered by significant operational issues, defects, a lack of human-centered design to more seamlessly serve the people of Maryland, and a significant projected FY23 budget deficit. We took immediate and decisive action. Together with colleagues Secretary Herrera Scott of the Department of Health and Secretary Savage of the Department of Information Technology, we appointed a new executive director for MD Think, whose name is Pat McLaughlin. Together, we've tightened fiscal controls, right-sized the workforce, and paused all non-essential development so that we could begin to address the significant oversight and management control failures. Together, we've reduced the projected FY23 budget shortfall from an estimated $100 million down to $6 million. A critical piece of this work is how we are racing the clock to improve the customer service experience on the MD Think consumer portal. We simply cannot move fast enough to make sure that Marylanders get fast and accurate access to benefits. To be clear, MDThink was not designed or built in a mobile-friendly way. Ease of access on cell phones is but one of the many challenges we are addressing. Though we have multiple strategies at play to address this challenge, we'd like to highlight our partnership with Code for America, a nationwide leader in bringing human-centered design to government services. This year, we will make significant design improvements to the MDThink consumer website so Marylanders can get the help they need more quickly. Code for America is helping us better understand the challenges our customers, staff, advocates, and community-based organizations face in using applications that are part of MDThink. We will rapidly prototype a new, simpler application on the MDThink platform later this year. We remain committed to leveraging technology to accelerate access to services, and we must make sure it actually works for the people we serve before claiming it as a finished product. We will modernize MDThink to be more mobile-friendly and move toward a reality that universally connects benefits across agencies. We are not there as of this moment, that's the truth, but commit to doing better and holding ourselves accountable for this progress. The FY 2024 deficiency request will allow MDThink to focus its resources on course correcting and delivering desperately needed MDThink fixes to several DHS applications that Marylanders and our team members use every single day. They deserve nothing less. The 10th and final area we'd like to highlight is about how we're trying to better align our grants with the outcomes we seek. We partner with more than 70 nonprofit community-based organizations across Maryland. We cannot do anything, or any of our work without these kinds of partnerships and the support of people who power these organizations to provide a range of human services, including emergency food assistance, outreach, refugee settlement services, employment and training services, English as a second language help, and so much more. We are grateful for their service to the people of Maryland. What has been stunning to learn during this first year, take a breath, is how long it takes for us to process a grant agreement or process invoices. So as I was sitting here listening to Tanya for the second time today, what I was doing with this team via chat and messages was responding to yet another organization for unpaid invoices of millions of dollars. I cannot tell you how much this enrages me. And I want to say loud and clearly in the record, I am sick and damn tired of it, because this did not happen overnight. And that this has come to be normal in Maryland is absolutely unacceptable. And I'm tired of making excuses and tired of apologizing on behalf of the Department of Human Services and on behalf of the state of Maryland. I am done doing it. As someone who has been a leader in the nonprofit sector myself, I know how important it is to maintain a good cash flow. And no organization should have to front the government money for which it is rightly owed. When we fail to pay our partners on time and make them wonder when that deposit will hit their bank account, like the minutes I was spending over here doing just that, we are making it even harder for them to do the work that this state has asked them to do. On behalf of the Department of Human Services, I'd like to apologize for the 1,000th time on the record for the inconvenience that this state has caused our partners. And to be clear, it's not just the organizations, it's the people they serve who elect you and put us in office. While it took years to get to this point, we are racing the clock to course correct, and it will take us some time to make things better. This is not normal. And no one should accept this is just the way things are in Maryland, quote unquote, something I hear all the time in this work. In addition, many of our grant agreements do not have measurable outcomes. We should think about that for 1 second. The second largest department in the state of Maryland does not have measurable outcomes in its granting contracts, and this isn't new. That might sound insane, but it's true, and we'll be changing that moving forward. A good partnership is one in which expectations are clear, where we hold each other transparently accountable for results in the name of those we serve. We are working to change the way we write grants so that a year from now, we can more clearly articulate to this committee and the entire legislature what services we paid for and the results they produced for Marylanders. And all this will be made publicly available on our website so that everyone can search for it, not just the lobbyists. This budget proposal is assembled in partnership with many of you and others who advocate tirelessly for the Marylanders we serve. We stand ready to work with you to deliver bold investments in a fiscally responsible way to make this Maryland's decade. Now I'll turn it over to our Acting Chief Financial Officer, Carol Resnick, to briefly summarize our responses to the DLS analysis.
Thank you, Mr. Secretary. Thank you, members of the subcommittee. Good to be before you again. I'm going to summarize both our responses to the DLS questions as well as our response to their recommendations. As you know from reading the analysis, some of those are duplicated, but I will go ahead and go through them all to make sure that we're consistent. The first question raised by DLS is asking DHS to comment on efforts that it has taken and plans to take to improve application process timeliness for both TCA and TDAP. In our response, you will see a fairly extensive answer that I encourage you to read through, but I will summarize it now. Our FIA administration, our FIA administration, works on a weekly, monthly, bi-monthly, and every 6-month basis to make sure that our local offices are in compliance with the processing times. They measure numerous key performance metrics, including timely approvals, denials, the average days it takes for the department to make an eligibility decision, et cetera. If a local department fails in these compliance checks at any one of those periods of time, there is a plan of action to correct those compliance issues that consist of technical assistance, corrective action plans, visits from our FIA teams to the local departments to help course correct, and non-compliance mitigation sessions. These kick in whenever a local department hits below 96% compliance standards with regard to eligibility, to determination. The department has also taken several steps to improve application processing timeliness, implementing workload sharing so that if a particular jurisdiction is behind on their processing, that workload can be shared across jurisdictions in order to improve timeliness, focusing case managers on processing applications. DHS recently was approved for a new call center, as the secretary described, at the Board of Public Works meeting on January 31st. DHS is also in the process of requesting a waiver from the federal government to allow call center agents to perform certain functions typically completed by case managers. We expect that call center agents will be able to help customers schedule interviews, update customer addresses and phone numbers, pursue missing information, screen eligibility, and much more. The purpose of the waiver is to reduce the burden on case managers so that they can focus on actually processing these applications. Finally, and I will describe this a little more in detail in several questions down, but DLS is implementing a new software system called QLESS, which is a appointment scheduling tool that is expected to dramatically decrease the number of missed appointments and application interviews moving forward. Second question, DHS should comment on the cause of increases in TDAP denial rates since May 2023. During the pandemic, TDAP applicants were allowed to self-attest their disabilities, and the requirement to provide a medical document of disability was waived. Since the end of the federal COVID-19 public health emergency declaration and associated federal flexibilities, DHS has resumed normal program requirements. Many of these COVID era cases would not have been denied for lack of medical documentation are now subject to those denials. DHS should comment on efforts that it is taking to reduce case closures due to failure to provide verifications. Missing interviews is among the top 3 reasons for denial and for the time it takes to reduce case closures. Cases remain pending for up to 45 days after an application has begun. So missing an interview and missed supporting documentation results in case closures, either approved or denied, that remain pending for extended periods of time. The department recently secured a partnership with QLESS, as I mentioned just a few minutes ago, to develop an appointment scheduling system on the MDThink platform. With this functionality, customers will be able to schedule and reschedule appointments on their own, which is novel for us. This functionality will significantly improve compliance with interview requirements and thereby decrease the rate of denial for missed interviews. The other top 2 reasons for denial are individuals who are over the income requirements and failure to provide documentation to demonstrate eligibility. DHS should comment on its outreach efforts to recipients on recipients and other potentially eligible individuals to ensure that they're aware of the program and requirements, programs and requirements to rectify benefits that have been denied. DHS partners with 31 community-based organizations that conduct outreach to help enroll families in both SNAP and cash assistance programs for which they are eligible. These organizations play a vital role in providing application support and ensuring that households that are due to renew their benefits maintain eligibility. The CBOs helped 21,766 households, as was mentioned, submit applications or renew their benefits last year. In addition to support provided by the CBOs, DHS issues at least 2 case renewal notices to each customer. These include an initial notice and a reminder notice. The initial notice is sent to customers at least 60 days before the renewal date. If the customer has not submitted the renewal application and related documentation, a reminder notice is sent to customers 15 days before the renewal date. DHS partners with Benefit Data Trust, one of our outreach partners, to text customers with a pending renewal. The department sends an initial text message and several follow-up texts depending on the status of the renewal application. DHS should discuss why certain funds did not revert as required. As noted by the analyst, in fiscal year 23 year-end close, DHS reported a total of $43.5 million in expenditures, of which 35 were funded by the dedicated purpose account funds, and the remaining $8.5 million were funded by the interim assistance reimbursement and child support offset. The offset for other benefit costs in fiscal 23 were funded with the interim assistance reimbursement and child support offset. DHS did revert $173,212 of these 2 funds that were not expended. DLS recommends reducing the federal fund for SNAP by $200 million for better alignment with anticipated spending. DHS agrees with DLS's recommendation. DHS should discuss how it will fully fund salary and wages for fiscal 25, given the higher relative budgeted turnover compared to vacant positions for the current vacant levels. As noted by the analyst, consistent with the governor's Rebuilding State Government Initiative, DHS has substantially progressed in filling our vacancies, not just within FIA, but throughout our department. In preparing for our budget submissions for FY23, we completed a salary analysis which revealed underfunding for salaries at about an 8.5% vacancy rate. To address the concern, the governor allotted an additional $19 million. This requested allocation was included in DHS's 25 budget and will allow the department to continue to reduce vacancies while maintaining funding for these salaries. DHS should discuss the status of its interim and financial plans of operation with regard to the summer EBT program. The U.S. Department of Agriculture's Food Nutrition Service, FNS, requires that Maryland submit its proposed plan of implementation by February 15th, 2024. Yes, that is today. And I believe that submission has either taken place or will by close of business. DHS is working with MSDE to ensure that an estimated 500,000 Maryland school children receive these benefits beginning June 2024. For more information, you can see DHS's departmental bill on this subject, HB 183, SB 213, and we've attached to our testimony, to this testimony here, our testimony for that legislation as well for your information. DLS recommends adding language to transfer the funds to administer the summer EBT program to the local FIA program. The $1.6 million placeholder for local match, which is special funded, is necessary to implement existing state law with regard to the summer SNAP program. If the General Assembly passes our departmental bills that I just mentioned and the corresponding appropriation in the state budget, the new summer EBT program will not require a local state match that is represented by the special fund allocation. DHS does disagree with DLS's recommendation to transfer the funds to the local family investment program. The fund should be maintained in the current program to provide more flexibility in administration. Unlike the current state SNAP program, the federal program does give states flexibility in how they administer summer EBT. Our approach will include a combination of local and state office staff to implement. Number 10, due to the lower estimated cost, DLS recommends reducing general funds for benefit replacement by $7.5 million. DHS disagrees with this recommendation as well. We are working with Delegate Robin Lewis on a bill that protects the state's fiscal investment through SB2 that was passed in 2023. Currently, DHS has been advised by the Office of the Attorney General that SB2 creates an unfunded mandate on DHS to replace benefits even if there is no appropriated funds. DHS's latest operational guidance is the action transmittal, also attached to this testimony. The number of stolen EBT benefit reports fluctuated since the department started replacing benefits in March 2023. Cutting the program budget at this time would cause a significant risk to state general funds should the benefit replacement exceed projections and federal funding expires on September 30th, 2024, which at this time we anticipate unless Congress renews the funding. Number 11, DHS should comment on additional steps being taken to reduce incidents of EBT theft. If you can please see the pages 2 to 4 on our EBT card theft of benefit report, which is also attached to this testimony. That report is required pursuant to Human Services Article 5-609, submitted on December 8th, 2023. As noted in the DLS analysis, additional protective steps are being incorporated into the request for proposal for a new EBT system contract. Question 12, DHS should comment on outreach efforts to those potentially impacted by the ABOD requirement at the end of the public health emergency. Maryland resumed ABOD requirements on July 1st, 2023, after a 3-year pause due to the flexibilities provided by the federal COVID response. The Federal Fiscal Responsibility Act, the FRA, authorized new exceptions for veterans, former foster care youth, and individuals experiencing homelessness. The FRA also expanded ABOD requirements to individuals age 50, 52, and 54. The department sends notice to households newly subjected to ABOD requirements. The notices explain the requirements and provide a list of steps that the customer may take to meet the requirements or request an exemption if appropriate. The department is also taking other measures to support ABODs. The United States Department of Agriculture's Food and Nutrition Service approved Maryland's request to waive ABOD time limits in 5 jurisdictions, including Baltimore City, Prince George's County, Somerset County, Wycomico County, and Worcester County. The waiver is in effect from July 1st, 2023 through June 30th, 2024. Nearly 50% of ABODs living within the waived jurisdiction, represents nearly 50% of all ABODs living within the waived jurisdictions. DHS has been using discretionary ABOD slots to maintain slot eligibility for ABODs in non-exempt jurisdictions. The department continues to use discretionary slots and has not closed any SNAP households for failure to meet ABOD requirements. Question 13, DHS should discuss whether it expects to apply to participate in the pilot and readiness to implement new measures of work outcomes. Currently, DHS awaits the release of the federal TANF pilot project program instructions and application, which is anticipated this spring 2024. DHS provided comment also attached to our testimony on the ACF request for information. Moving to DHS's recommended actions. With regard to action 1, with regard to adding language for general fund appropriation, with regard to foster care maintenance plan payments, DHS concurs with this DLS recommendation. Recommendation 2, adding language with regard to the summer EBT program and moving the $9 million to the local family investment program. As earlier noted, DHS disagrees with the transfer of the local family investment program for the reasons stated previously. We believe that it is best to administer the program from our central offices with help and input from our local offices. With regard to recommendation number 3, to cut EBT, to reduce the EBT budget by $7.5 million. As stated earlier, DHS disagrees with this reason as well. There is a significant risk that it exposes the state to fluctuating EBT replacement applications. Recommendation number 4 was to reduce special funds with regard to the summer SNAP program in $1.5 million. As noted earlier, this $1.5 million represents local contributions to the summer SNAP program. If the legislature passes HB 183, SB 213, and the corresponding appropriation, then we have no objection to the move of special funds as they will no longer be necessary. Recommendation number 5 is related to, again, moving the $9 million administration costs for the summer EBT to the local family investment program. And we also disagree with this recommendation related to the previous ones. Recommendation number 6 is to reduce federal funding for the SNAP program in the amount of $200 million to align with DLS's analyzed caseloads. DHS concurs with this recommendation moving forward. Recommendation number 7, to add narrative with regard to the application of processing times, application denials, and case closures. DHS concurs with this recommendation and is happy to submit these reports. And the same goes for recommendation number 8, adding narrative for the summer food benefit program. DHS concurs and will be happy to provide this report as well. And with that, we're happy to take questions, and we encourage you to support the governor's budget. Or the governor's allowance, excuse me.
Thank you, Mr. Secretary. Senator Hadelman, a little slow to the trigger.
Yep. Thank you, Mr. Chairman. Thank you very much for this very comprehensive report and response. I have 2 questions. One has to do with the summer EBT program, and it says that you have to do individualized assessments, and in the face of CEP and moving away from that, can you just go into detail a little bit about how you're going to tackle that?
Sure. Go ahead. You want it? Go ahead. Okay, so just so I make sure, I want to clarify, just make sure I understand. You're talking about the replacement of stolen benefits, correct?
No, summer.
Oh, summer EBT?
Summer, yeah.
Okay. Go ahead.
So, for the record, Carnitra White, Principal Deputy Secretary, Department of Human Services. For summer EBT, we're going to try to make this as seamless and simple as possible. So for any children ages 5 through 18 who are on our SNAP rolls, we will automatically enroll them into summer EBT. There will be, but this program will allow us to enroll people who are not on SNAP. And so we estimate about 50,000 children who are not on SNAP, and we're going to be working with MSDE to have a match up. And what we'll need those families to do is just to go in and apply for the program, but they will automatically be enrolled. We don't have them in our systems, so we'll need to put them in the system in order for them to receive the benefit, if that makes sense.
Okay, so they'll still have to go and fill out the paper, all the families.
But
will
it'll
have to
be
do-
very seamless and simple. We'll have their information, and it'll be the way I think the way that we're working to design it is more like an attesting to the fact that this is them and this is their child and where the benefit will
like
be.
pre-filled out. So,
Correct.
okay. Which leads to, I guess, my second question is, if that's okay, Mr. Chairman. And I think this is the point of MD Think is kind of a one-stop shop for all the zillion forms and competing eligibility requirements for all of these different programs that you've just gone through. And so, and I know it is your interest and desire to make it as easy and then user-friendly as possible, since, I mean, this is a struggle for a lot of people, and they have the daily struggle of living and then trying to access these. And sometimes we all know that these programs are not utilized by as many people who are eligible for them, which is a separate issue. But just in terms of access and ease of access, if you could just talk a little bit about that process.
And it's interesting, is when I was listening to your question, the first one, where my brain went was around what we did on stolen benefits to make it easy. And I think that would be a great example to offer. So how you approach this work to either make it easy or hard for people is a matter of philosophy. And we thought, if you are a mom and you have had your benefits stolen, why are we going to force you to prove again to us that your benefits were stolen if in fact on the back end, technologically, we know for a fact they were on 1, 2, 3, 4 occasions at these 1, 2, 3 locations across the country and for this amount of dollars. That's the same philosophy we're trying to apply both to summer EBT to make it easy. So you're attesting. So right now, if you go on, the way we designed the stolen benefits was that We are saying if you believe you had benefits stolen, go on, attest that you're telling the truth, essentially, and then we will course correct it. We were able to actually replace benefits in some cases in 24 hours. Our max was up to 10. Our department has never done that before. The average is about 3 to 5 days. I would say that's still long, but that's better than what we've done. So trying to model using technology to make it easier on the person. That is the same philosophy we're using to try to modernize MD Think, which is that unfortunately, for whatever reason, the way in which it had been articulated, even still on some of our website parts, is as if that's the way it is now. That's not true. Right now, if you go on to get help on SNAP, it is you're living in a particular narrow world. But if you are that same mom and you are then eligible for a bunch of other services, let's say WIC, you might have a baby under 5 years of age and you've applied for Medicaid, that you've just roped in 2 other departments, the Department of Human Services and the Department of Health. Secretary Herrera, Scott, and I and our teams respectively are working to eliminate those kinds of barriers. Why? Not making you as the mom tell your story multiple times when you are federally eligible and state eligible for programs to which you are entitled. And so it's just a shift in how we're approaching it. It also takes some significant lift. We're about to go to a budget hearing on the operations side of our budget around really investing deeply in MD Think to course correct this. And that's not going to happen overnight, but we're doing it because we don't believe we should make you tell that story over and over, and you should get those benefits much more seamlessly and easily.
Thank you. Thank you, Mr. Chairman.
Thank you, Senator. Secretary Lopez, just one question. In reference to the new program that's being administered or foresee to be administered, we had earlier discussions about the summer SNAP program that was previously passed was administered on a bi-weekly. So it was 2 different appropriations that had went out, and the advocates that had put that in place, they had put that in place because they saw that when folks got that one appropriation, that spending could be gone in a 3-week period, and then they find themselves back in a food insecure position from that piece. So I applaud the work that you're doing, but is there any more research that you've looked at into this, and how can we move back into that direction? Because I do think that they brought us a problem and put forward something that was solvable at that moment, and now they feel as though we're recreating it, and they have a valid point.
I'll give you a quick answer and then a little bit of a nuanced one. The quick answer is we're not trying to go back. We're trying to actually make this as seamless as possible. And so we are continuing to research this. As our acting chief financial officer said, our team just literally a couple of hours ago forwarded the plan to USDA for review and this draft in conversation with the Department of Agriculture. For context for everyone who might not be as up to speed on this, the federal rules helping describe to states how we can apply came out, I think it was December 29th or 30th of 2023. We're still trying to better understand what our state flexibilities are to look at the exact issue, Senator, that you're mentioning, which is a look at when we could actually transmit payments to families. Ultimately, the summer EBT program will allow for families to receive $120 per child over the summer months or $40 per month. We're trying to figure out what those options are. As we shared with you when we met with you, we are open to exploring a variety of options and making sure that we have as much flexibility on the state side, but we're still trying to better understand what the federal government's going to require us to do. So in the grand scheme of things, we are open to that option, as we shared with you personally in your office. But in this go back and forth with the federal government, we're not quite sure yet is the honest answer. So happy to do that, happy to be as flexible as possible. But our number one goal is to get Marylanders who are eligible for that $120 grocery buying benefit over the summer months.
Yep, just know I got an interest in that, keeping that conversation.
Understood. Absolutely. And we're committed to keeping you up to speed, and we will, both you and the committee, because it's going to be a shift for Maryland. And we're going to do everything we can to be flexible and as swift as we could be in that process.
Perfect. Seeing no further questions, Mr. Secretary, I just want to thank you again for your leadership. We saw that there were a number of issues that you walked into last year, and you were able to swing the bat and hit home runs. And Ms. Zimmerman, just want to thank you again for your leadership and just giving us the analysis to help us to better understand what's going on in the agency. Thank you again. Colleagues, seeing that this was the only agency report, this ends the hearings for